Over the last few years, it's come to my attention and my colleagues' attention that patients who use wheelchairs have difficulty getting the medical care that they need. What we found is that sometimes patients have difficulty getting appointments, and other researchers have shown that patients who use wheelchairs don't receive as much preventive care and often miss appointments or don't see specialists when they need to. We wanted to understand this better, and so we called 256 practices, 8 different kinds of doctors in 4 cities across the country. We were attempting to make an appointment for a hypothetical patient. This patient has had a stroke and is unable to use half of her body, and so she's unable to transfer herself from a wheelchair to an exam table. What we found was that about a fifth, 20%, said that they were unable to make an appointment for the patient because their practice was inaccessible. In only 9 of these cases was it because the building was inaccessible. That is, in only 9 of the cases were there physical barriers or reasons that the building was inaccessible. The rest of the time, the practices were unable to transfer the patient from her wheelchair to an exam table. Among the 200 practices that were accessible, a majority, 51%, had plans to transfer the patient from a wheelchair to an exam table in a way that is deemed to be unsafe by disability experts. The benefits of a lowering exam table are that they allow the patient sometimes to transfer themselves safely, and certainly with the help of staff to transfer safely from a wheelchair to an exam table, without many of the risks that are posed to staff and patients that are associated with lifting a patient from a wheelchair to a high, non-lowering exam table. I think we've outlined the starting point. I think we know where some of the problems are now, and I think that we can use this study to gain momentum to help physician practices across the country learn how to comply with the Americans with Disabilities Act and learn how to provide better care for patients with mobility impairment.